This is a presentation about Asian Indian culture by Kathryn Harvery, myself, and Brittany Cook. We chose the culture of India and the Hindus. India is located on the continent of Asia. It is a peninsula, and its population majority age, the majority of their population is ages 15 to 64. Their life expectancy is 66 years of age. Their main language is Hindi, and English is very commonly spoken, and it's used as a common dialect between people of different languages. Their main religion is also Hindu, and that is in India as well as in Asian Indians who live in the United States. Their physical characteristics that are very similar are various different brown skin colors and shades of brown skin, brown eyes, and straight black hair. The family roles for Indians and Hindus. The women typically stay at home and cook and raise the children and manage all the finances, keep the house clean. Men work and make the money, and they're the main decision makers of the family. Grandparents, typically several generations, live together under one roof, and the grandparents live in and assist in raising their grandchildren. Women, once they marry, they move in with their husband and their families. Many health decisions are made as a family, but the eldest male is typically looked to for the main decisions. Their religion is Hindu, which plays a large part in their health beliefs of karma and reincarnation. Their health beliefs is karma is a law of behavior and consequences in which actions of a past life affects the circumstances in which one is born and lives in this life. Their traditional Indian medical system is Ayurveda, which focuses on a balance of spiritual, physical, and mental health as a whole, and balancing of the doshas in their body. They believe a lot in the use of herbal remedies, prayer, massage oils, and also diet changes. Some common health problems in Asian Indians are hypertension, coronary artery disease, and type 2 diabetes, a lot of these which have to do with their high-fat, high-carb diets.
In the Asian Indian culture, women's health and pregnancy, rebirth is a time as at the baby's birth, reincarnation occurs, and a deceased person's spirit will come into the new body. Pregnancy is considered to be a hot state, so they try to stay away from specific herbs and spices and hot foods while they are in delivery. While they are pregnant, they are encouraged to remain at home for the safety of the pregnancy. And during the childbirth, men are not normally present in the room. The birth will be assisted by an elderly woman. On the 11th day after the childbirth, the child will be named and there will be a ceremony. And on the 6th day, they actually have a ritual where the baby is wrapped in a blanket and red powder is placed on the baby's hands and feet. And that's when the Holy Spirit is descending on them. They're not to be touched. After childbirth, it is encouraged for the woman who had the baby to have a 40-day recovery period. As far as the nutrition goes for the Asian Indian culture, the diet is comprised of a lot of high-fat foods and high-carbohydrate foods. Rice and tea is tended to be served at every single meal, and food is considered to be either hot and cold, and this is to keep a balance of the doshas. And then fasting is also another practice that the elderly women will practice. This is said to help with the wealth of a family, and many older women will practice this. As far as death practices go, many families will tend to want their family members to have their death at home. At times, the person who is dying will request to lay on the floor, and this will put them closer to Mother Earth. At the time of death, families most of the time will want to perform the postmortem care as far as washing, cleaning, redressing them, and they will also have a Hindu priest that will come and do a prayer over the deceased patient. Many families and most patients who have deceased ought to have a cremation over burial. The cremation is because they want to spread the ashes over the Ganges River, which is considered to be their holy river. And once again, reincarnation is a large part of the death. The Hindu people believe that when they are reincarnated, they will come back into a body and they will be reborn, and that ties back into the birth. As far as nursing implications go, if you're taking care of pediatric patients who are in the Asian Indian culture, it is important for adults to be present for the children. The children will most likely handle the care better if their parents or their grandparents are with them. It is also important to be very respectful of their religion. Their religion is of utmost importance to them, and this has a lot to do with their dietary restrictions. They're vegetarian. Be sure, especially for pregnant people or pregnant women, that you provide different sources of protein for them, and just ensure that their dietary restrictions are followed. As far as the sacred thread, the women and the men are requested to wear a sacred thread. The men, they wear theirs across their chest, and the women wear theirs on the neck, and it's important that you ask permission to remove it prior to removing, out of cultural respect. As far as modesty goes, it is important to their culture that men have men healthcare workers and women have women healthcare workers, and this is just they're very modest, and that it's important for them to stay in their own sex. And then as far as autopsy and organ donation goes, it's oftentimes frowned upon. They prefer to, of course, have the cremation, and they do not normally want an autopsy. And as far as herbal supplements, many patients who are Asian Indians take herbal supplements, and it's important because they oftentimes won't stop that when they're admitted to the hospital. So it's important that we have proper documentation about what herbal supplements they are on, so that we can ensure that we're not giving them any medications that will conflict with what type of herbal supplements they are currently taking. As far as an ethical dilemma that we can be mindful of when patients are in our hospitals, one that could be considered would be the karma and pain and suffering. So a lot of patients who are dying or suffering oftentimes think that this is a direct correlation with the bad karma that they have, and they will oftentimes encourage their family members, or they themselves do not want to take pain medications to help with the suffering because they feel that's correlated with their bad karma. We can always provide education about the type of pain medications and the comforting measures that we could give them, but we really need to be ethically aware and ethically and culturally sensitive and realize that this is what they believe, and if that is what they believe, we can educate the best we can and encourage them, but we really need to be open-minded and respect what they have decided. This is our reference page, and that was our project. Thank you.